I'm here to validate for Professor Hayes, class 602, on central line dressing change. So to begin, I would obtain my physician's orders, wash my hands, gather my equipment. I would introduce myself to the patient and identify her. I would ask her to state her name and date of birth and compare it to her ID bracelet. I would also provide privacy and explain the procedure. So to begin, I would start by assessing her comfort level. I would explain that I'm going to be changing her central line dressing, and I would instruct her not to touch any of my sterile equipment or the central line site throughout the procedure. This helps to maintain sterility. Now I'm going to raise the bed and place her into a low Fowler's position. Before I start, I would sanitize my work surfaces, wash my hands or use hand sanitizer, and I would drape the patient, exposing only the central line site. So now that I can see the central line and the old dressing, I would assess for any signs of redness, swelling, irritation, or infection, and I would also assess her comfort level. So now to begin, I would open my central line kit. I'm going to throw this away. And I want to carefully open my kit. I have my sterile gloves and my mask. And while opening the kit, I want to stay within my 1-inch border to maintain sterility. So now that I have my kit open, I'm going to don my mask. Along with my clean gloves. And I would instruct the patient to turn their head away from the central line dressing. But in this case, I'm going to assist her. So now that her head is completely turned away from the central line dressing, I'm going to begin by removing the old central line film. And I want to be very careful not to disrupt the central line site. So now that I have removed the old central line dressing, I can reassess for signs of infection, irritation, any signs of infiltration with redness, swelling, and ask her if she's having any pain around the central line. So now that her central line is exposed, I can begin to put on my sterile gloves. Move these over here. Stay within my 1-inch border. I'm going to pick this glove up by the cuff and placing my sterile glove on. And this one I'm going to pick up by the cuff and slide my sterile glove underneath. Releasing, along with the undercuff of this one, maintaining my sterility. So now that I have my sterile gloves on, I'm going to move this aside, and I'm going to open all of my materials inside my central line kit. So I have my ChlorPep applicator. I'm going to crack the two sides, allowing the fluid to flow onto the pad, and I'm going to cleanse all of the skin around the central line dressing in vertical and horizontal strokes. So now that the skin is completely clean around the central line dressing, I'm going to throw out my applicator, and I need to place my new central line transparent film over the dressing. I'm going to throw this away. And I want to make sure this is completely occlusive to the central line, making sure there's no wrinkles or holes to prevent any contamination to the site. Now that my new central line dressing has been placed, I can reassess her comfort status. I'm going to remove my gloves along with my mask. And before I cover her for privacy, I do need to place my label on the new central line dressing, specifying my name, the date, the time, and when it's due to be changed next. And I'm going to place this on the side, but not directly over the central line. And I'm going to cover her for privacy. I would lower the bed for safety, reassessing her comfort status. I would need to clean up all of my equipment, document my observations that I saw throughout the procedure, including documenting my eyes and nose. I would need to wash my hands, maybe help reassisting her to turn her head back, wash my hands, and give her her call bell. Thank you.